Hi, and welcome to the K&A Talk Show. Today, we'll be talking about Diogenes syndrome.
Diogenes syndrome happens when a person does not take care of themselves or their surroundings, which can lead to poor hygiene and possibly some health and social problems. It often occurs with other conditions such as dementia. People who have Diogenes syndrome show signs of severe self-neglect, social isolation, and hoarding. If you can't imagine what Diogenes syndrome looks like, here's a picture for a deeper look into it. Medical conditions that Diogenes can also have is hoarding, mania, frontotemporal dementia, OCD, and alcohol abuse disorder.
When there is no other medical condition, scientists say that other reasons people have Diogenes syndrome is because they face a traumatic event, such as a death of a loved one. It is also common among people who are over 60 years old and who live alone.
The symptoms of Diogenes syndrome are extreme social anxiety, OCD tendencies, excessive hoarding or collecting of household items and waste, poor diet, fear of distrust of medical professionals and settings, unwillingness to accept outside help or intervention, hostility and aggression towards others.
Now, we're going to give you a look into the life of Mrs. W., who struggled with Diogenes syndrome. To protect her identity, we will not show her face, however, we will show what conditions she was living in.
Miss W was a 78-year-old white woman who was a retired office clerk with no previous psychiatric history until after the death of her husband 7 years earlier. She was brought to the attention of the police when her neighbors reported an offensive odor coming from her home. Forced entry was necessary after Miss W would not answer the door. Officers discovered a filthy living space crammed with all kinds of garbage, including decomposing foods and feces. The patient was found in the living room wearing a winter coat in the middle of August, with her hair matted and her skin ingrained with dirt. The patient was hostile and insisting that she be left alone. She was admitted involuntarily to the psychiatric ward unit of the hospital due to an inability to care for herself.
Lastly is a treatment to help this syndrome. As of right now, there are no current medications or therapy options specifically to manage Diogenes syndrome. Medications for other conditions may help alleviate symptoms such as paranoia or mania. Psychological factors are also important to consider as they can trigger the syndrome or cause it to continue.
People with Diogenes syndrome suffer an increased death rate. Over 46% will die within 5 years. Usually from physical illness resulting from living in a squalor and self-neglect.
Thank you for tuning into this segment. Come back next time to talk about more psychology on the K&A Talk Show.